We will go ahead and get our Risk Management Committee meeting into order. I'll read this statement. This meeting is of the Benefits and Insurance Committee is being conducted electronically pursuant to Governor Bill Lee's Executive Order 16. I would ask for a motion that conducting the meeting electronically is necessary to protect the public health, safety, and welfare in light of the coronavirus. Do I have a motion?
Motion.
I have a motion, and do I have a second? Mary on the second?
Yes.
Okay, without objection. Madam Clerk, please call the roll.
Preble Acton.
Yes.
Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell. Shay Crowell. Holly Deering.
Here.
Alan Farley. Alan Farley. Mary Hickerson.
Yes.
Lois Miller.
Yes.
Alan McAdoo. Here. Jeff Phillips. Jeff Phillips. Is that a yes, Mr. Phillips? Okay. Shantae Sherrill.
Yes.
Eric Tutobeni.
Here.
All right, we have a quorum. Next on the agenda, members, is approval of the minutes from our last meeting. Is there a motion? Have a motion for approval from Lois, second from Preble. Any changes, additions, or deletions? Hearing or seeing none, call the roll, Madam Clerk.
Preble Acton.
Yes.
Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell. Holly Deering.
Yes.
Alan Farley. Mary Hickerson.
Yes.
Lois Miller.
Yes.
Alan McAdoo.
Yes.
Jeff Phillips. Shantae Sherrill.
Yes.
Eric Tutobeni.
Yes.
Motion passes. Next, members, is item number 2, financials. Mr. Elam, you're recognized.
Thank you, Mr. Chairman. On the Fund 264, we will start with the month of December. You had $8,464,167 in revenue. Expenditures was $6,554,464. You had a difference of $1,909,704. Below that, you will see where you had total enrollment was 6,285. For the calendar year, your total, and this shows for 2020, the full year, you have in revenue $83,638,539. And in expenditures, you have $83,965,565 for a difference negative of $327,026. And if you move down to the bottom for 2021 fiscal totals, is in revenue is $35,331,586. Expenditures is $43,782,333. And your difference is a negative $8,450,747. On the 264 fund, I'm sorry, the 266 fund, the first graph, if you year over year paid claims, you can see where that is on the graph. If you move over to the tracker, the next page, for the month of December, there was $30,163.42. Of that $30,000, you had $1,619 in workers' comp, and OJI was $28,544 to get your total of $30,000 plus. Year to date, 2019, you had $223,053.86 compared to this year at $326,284.52. Mr. Chairman, that concludes my report on the financials.
Okay. Any questions for Mr. Elam? Any questions? Seeing or hearing none, if you would please call the roll, Madam Clerk. Is there a motion? Oh, I need a motion.
Mr. Chairman, this is Jeff Phillips. I move to approve the report.
Got a motion? Second. Ms. Acton. Mr. Phillips on the motion. Call the roll, please.
Preble Acton. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell. Holly Deering.
Yes.
Alan Farley. Mary Hickerson.
Yes.
Lois Miller.
Yes.
Alan McAdoo. Jeff Phillips.
Yes.
Dante Sherrill.
Yes.
Eric Tutobeni.
Yes.
Thank you. Motion passes. Next we have
I have the revised. Okay. What I wanted to do is bring to the committee on this 266 revised fund, revised report. If you compare it to the one that's presented at this time, there's a couple of things, and I kind of want to do what the wish of the committee is. But the attempt here is to, we read off a monthly report, what the dollars are. But I think, you can have a good month, a bad month, you can have a good year and a bad year. And I wanted to try to show something that showed a trend. So I wanted to be able to provide you with a report that it could give you a good idea where we're moving as a whole. And I had the opportunity to meet with Commissioner Phillips, and this is kind of what, he was picking my brain, and I wanted to, as he says repeatedly, it's, what are you doing, how are you trending? So if you looked at this 266 revised report, what it will do is it will give you the actual where we are in 2021, the numbers, and where we are at 2019. And if you looked over at the year-to-date totals, this is one of the things that kind of spurred this for me. When I looked at the difference in last year and this year, the first thing I wanted to know is, why is that increase there compared to last year? And then when I went back and looked at 2018 and 19 and 2017 and 18, and I pulled those totals at this same time, it didn't make this year look quite as bad, and it really made 2019 and 2020 a much better year as far as the totals are concerned. And then another thing is about providing you with this report, this particular one, and I'd like for, if it's no objection from the committee, to replace the one that we're putting out now, is that if you look in the year October 2018, and you look at, under the month October 2018, you'll see where under workers' comp, there's $158,000 there in claims. And then you might move down to the year 2017, in the month of July, you have $152,000 just in that 1 month. And, each month doesn't quite tell the story to me as much as what it is combined for the year. And it gives you a trend. And so if you look at the totals year to date for each year, you can see from 2017, 2018, 2019, we're still trending down, even though this year's, not as good as last year, but it still shows a trend going downward and trying to reduce these claims. And so that's kind of what I'd like to do, is be able to show this and to show the trend, more of a trend instead of a month by month or just 2 years, if there's no objection by the committee. And then at the bottom, it shows the calendar year with the incident rate. And Commissioner Phillips and I have talked about this. We want to know, how do we not only compare from one year to the other, but we also want to know how we compare for the state. And so when you look at that incident rate, the state, you can also see that we're trending below that. And I'd just like, the feedback, if there's any objections to this report replacing the one that you're receiving now, or if there's anything that on the old report that you think that really is important for us to transfer over to this one. And the print's larger too. As I get older, the print gets harder and harder to read. So
that being said, is there any questions or comments or additions, deletions? Do you have suggestions for Mr. Elam?
This is Lois. I'd like to say that I really like this new one. I think that the comparison year to year on a dollar basis is extremely important. And the other report, while it had a lot of good information in it, it was a lot of information that we, in this committee, wouldn't necessarily use. And so I think this is a lot clearer, more succinct, and I really do like having that incident rate there, because that shows that we're working hard to improve on things as we go forward.
Okay, thank you, Lois. Lisa?
I like the report as well. This committee is focusing strictly on the claims. I guess I just don't want people to lose sight of the other expenses that occur, and maybe that's not a concern. I mean, that would be something I would be looking at, is in addition to claims, there's the handling charges and other expenses. And of course, I'm looking at how's the fund doing in total. And maybe that's what Lois is saying. That's a difference in perspective of what we're looking at. But what I would like to see is something similar on the insurance, of just looking at the claims. And because that report as well, let me just jump over to it. As you see it across, I mean, I like the report that you see month to month, for the whole year. And because this one, it's hard. The graph you had, I could look each month and say, we're this part through the year, we're off revenue expenses in total at this part, but then you always give the year behind to see how are we tracking for the year behind. I guess my end of my story, I'd like to see something similar to that on 260.
Other comments? Anybody else have any comments? Ed, can you add that to your report without making the numbers any smaller?
Yep, I will. I'll get with Lisa on it and we'll take a look at it.
Okay. Any other objection to the changes made by Mr. Elam, and to incorporate what I'm hearing, to incorporate Ms. Nolan's request as well to give us that data? I think both are good suggestions. Without objection, we'll adopt that. We don't need a motion on that. Just providing data. Okay. Anything else?
No, sir.
We move on? Okay.
No, sir.
We'll move to item number 3, workers' comp OJI stats. Mr. Edel?
Yes, sir. Dan had a family emergency this morning, wasn't able to be here, but I told him I would give his report for him. If you look at the OSHA report for the month of December in 2020, you had a total of 12 incidences, and for year to date, you're at 159. Your total recordables are at 115, with restricted day claims at 66, lost day claims at 27, and other recordables at 22. On the next page, you can see your graph where it says on-the-job injury claims. Year-to-date 2018 is 261. Year-to-date 2019 is 268. And year-to-date 2020 is 159. On your next page, the graph, you'll see on-the-job injury dollars incurred for year-to-date 2018, 573,000. Year-to-date 2019 is 493,000, and year-to-date 2020 is 814,000. On your next page, cause of injury, fall, slip, or trip, you had 5 with the Board of Education, 1 with County General. Strain or struck by, you had 1 Board of Education, 1 at County General. Cut, puncture, or scrape, you had 1 at the Board of Education and 1 at County General. And striking again, stepping on, you had 1 at the Board of Education. And motor vehicle, you had 1 County General. And for the total of the County General, you had at the Sheriff's Office, you had 2. EMS, you had 1. And maintenance, you had 1. Board of Ed, you had a total of 8. And County General, you had a total of 4. That concludes my OSHA report, Mr. Chairman.
Okay. You've heard his report. Any questions, comments? Questions or comments?
Move to approve the report, Mr. Chairman.
Have a motion to approve the report. Is there a second?
Second.
We have a second. If you would, please, Madam Clerk, call the roll. Preble and Mary.
Preble Acton. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering.
Yes.
Alan Farley. Mary Hickerson.
Yes.
Lois Miller.
Yes.
Alan McAdoo. Jeff Phillips.
Yes.
Shantae Sherrill.
Yes.
Eric Tutobeni.
Yes.
Unanimous on the vote. Thank you very much. Item number 4, MedPoint report. Ms. O'Neill and introduction of Heather Jenkins. Ms. O'Neill, are you with us? Amber O'Neill, are you with us?
Sorry, can you hear me now?
We got you.
Alrighty, thank you. I'm going to share my screen like I did the last few months, just to share the report with you in a visual. Can you see my screen up there?
We've got it. Thank you.
Perfect. Okay. So this is our report for the month of December for the MedPoint clinics. We'll start with some visit analysis information. On this, you can see that we saw 711 visits in December, and of that, 496 of those visits were unique members being seen. A unique member being seen is a single distinct person regardless of the number of visits or the locations that they were seen at. To go along with that, we had several holiday closures in the month of December. We closed on December 25th for the entire day. We closed half days on December 24th, December 26th, and December 31st. So seeing the increase there to 711 over November and even all the way back to September, we've had growth and the volume is a positive thing, especially with the additional closures. Alrighty. So in the month of December, we saw, of course, 711 visits. Of those, 76 visits were children, 530 were employees, and 105 of them were spouses. 330 of those visits were at New Salem, 177 at Stewart's Creek, and 204 of the visits were for Walter Hill. For our appointment types, 129 of our members had more than one visit in the month of December. One member had 6 visits, 11 members had 5 visits, 10 members had 4 visits, and 107 members had 2 to 3 visits. I did do a little research into this to see why there were so many visits per individual in the month of December, and I discovered that 75% of the patients with 5 or more visits in the month of December were all COVID related. So they were all people who had recently been released from hospitalization or who were battling symptoms of COVID. Additionally, beyond that, that other kind of 25% were patients with either a new chronic condition that needed some additional follow-up work until we could get a good stable plan for them, or we had quite a few people taking advantage of the nutrition counseling combined with their routine care and their acute care, which can just add to the number of visits per month. So we're excited to see people taking advantage of seeing the dietitian. And then we had a couple of situations where we had an acute issue requiring multiple follow-ups just to get that acute issue managed. If you look here, you'll see that 308 of our visits were established patient visits. Those continue to be our largest volume of visits, which is completely understandable. An established patient visit is usually the most utilized because it's everything from sick care to chronic disease management. So any of those would fall within that established patient kind of window. 47 of our exams, however, were those routine annual exams for December, and 38 of those exams were dietitian visits. So we're excited to see that kind of disease management, health management, and wellness care being such a good focus, especially in the month of December. The visit summary by day. Mondays and Tuesdays were the busiest days for the month of December, and there were 5 Tuesdays, Wednesdays, and Thursdays in the month of December. Saturday continues to be our lowest volume utilization, but that balances with the fact that we only have one of our clinics open on Saturday, so it's not the volume of 3, it's the volume of only one clinic open that day. This is our in-person visit versus our virtual appointments. As you see, we had 255 virtual appointments in the month of December. Stewart's Creek and Walter Hill continue to remain with the highest average of virtual visit utilization. I looked into this as well just to see with that high COVID rate if that was affecting our virtual visit totals. And I did discover that in December, 52% of our virtual visits were done by choice, meaning that the members were not required to have a virtual visit due to symptoms, but they simply chose to out of convenience. And 48% were asked to use a virtual visit because their symptoms would keep them safely out of the clinic, but still able to receive care. If you compare that with November, we did see a little bit of an increase in that because in November there was a 57% done by choice and 43% done by need. So there's about a 5% increase in that need-based care and the virtual platform. And as you see here, just over 32% of the visits at New Salem are virtual versus almost 37% of the visits at Stewart's Creek being virtual, and a little over 40% of the visits at Walter Hill being virtual. Again, not surprising with the places that those are taking place in, because at Walter Hill, obviously we only have one exam room, so that virtual visit really adds to the care there, allowing us to see more patients in a safer environment. In our referral platform here, you'll see that we did a total of 71 specialist referrals, not necessarily outside, but specialist referrals for the members in the month of December. Of that, the highest volume continues to be to the in-house dietitian. 28 referrals went to her in the month of December. And then secondary to that is gastroenterology, and third, of course, into sleep medicine. Sleep medicine came up a little higher in this month of December than it has in previous months. So people are taking advantage of that, which can also be some wellness-based care there after we get them treated. It's a great balance to see that dietitian referral be so high, which accounts for the 38 visits that we had in December for that dietitian. That's quite a few for a single month. And to see the 28 referrals go along with that, it's good to see that that's just going to continue to grow in volume. Moving into our financials, in December we had 496 total unique members, a total operating cost of $137,040.20. So that works out to a PEPM of $21. So I know that we've had this kind of little placeholder previously in the presentation. So just to kind of update you on where we're at with that, we have met and been working with senior leadership, the data teams, and clinical people here at St. Thomas, along with some communication with our partner there at Cigna, thanks Jack, to identify measures to start reporting to you for health tracking of the population. And we are hoping to add that soon to future reports for you, because we have started to identify specifically what those measures will be and how we will track them, so that you can start to watch the change in health and we can see where those trends are going for the members. In December, for our diagnoses, you'll see that essential type hypertension was the highest diagnosis code in the month of December, but still only accounted for 7% of the members. So not a huge total, but it still was the highest one that came out. But second to that, you'll also see that the adult health examination came in second again this month, which we just love seeing. We want to continue to see those preventative codes be among our highest used diagnosis codes. I will say that we have partnered with Cigna for our New Year, New You challenge, and we've been encouraged by member participation in that with the wellness-based health improvement measures that we are kind of piloting out with that. And with that, the week of February 15th to February 20th will be the annual exam week at the clinics, and so we'll have special times reserved for people to have their annual wellness visits. And additionally, we'll be providing some walk-in biometric screening from 8:30 to 11:30 at our New Salem location to allow for some easy access to get some of that wellness health screening done in a simple way outside of work hours, and to just allow that access so that they can easily get these things done. In December, 67% of the members' visits were female, and the age range of 40 to 49 in both female and male population was the highest population seen. That being said, you will notice from the totals that age range really didn't knock the other age ranges out of the park. It was close with a bunch of other age ranges. So we are seeing a good kind of balance of different ages within the clinic. In December, the female member population, for their highest percent of BMI, it was in the overweight range for 25 to 29.9. And then with the male member population, that BMI was in the 30 to 34.9. So again, kind of in that overweight for the females and the obese class for the males. So just still reiterating the need for that dietitian counseling and those referrals that we're doing, and to really kind of help with those health measures. Alrighty, before I end today, I did want to introduce you Heather Jenkins. She has joined our team as the Regional Director of Operations, and we're excited to have her with us. And I know she looks forward to getting to know all of you, answering your questions, and just being a great support here to our team. We were sad to see Chrissy Martin go, but we're certainly glad to have Heather here to kind of take over that role and see where she can take us with that. So if you would all take the opportunity to welcome her, that would be great. Thank you.
Heather, I have one question on slide 13 or page 13, talked about for the month of December, hypertension. Did you feel that that was because of COVID-related hypertension causing that, or COVID and Christmas, being cooped up at home? Any?
I don't know that we can really narrow it down to that when it comes to something like hypertension. When we're talking about a chronic kind of blood pressure issue, it could be related to a lot of things. So it could be related to diet, which could be affected by those having to stay home and not get their exercise or go to the gym or whatever that they're used to. It could be affected by the holidays and people not eating correctly and letting, their salt take up and creating their blood pressure levels going up and whatnot. But I don't think really, unless you went case by case on that, you could really drill it down to that type of specificity. And again, it was only 7% of the population that we saw in that particular month. So it's a snapshot of December. It's not necessarily a snapshot of the population as a whole. I don't think that it's indicative of the entire member population to say that like 7% of the member population has hypertension. That's not what we're really saying here. All we're saying is in that month of December, those people who happen to walk in our door, 7% of those had hypertension.
Well, thank you for that explanation. And so members, this is my personal opinion, but I'll thank you for your report, Amber. I think that this committee made the right decision. The report was easy to follow compared to our previous partner. I think that, Mr. Edom, would you say that our new location, moving from Blackman on Fortress over to Salem, has worked out well for us with our new partnership with St. Thomas?
Yes, sir, I do believe so. And, with the changes that have been made, I'm getting, the people that have gone to MedPoint in the past, they're very appreciative of the facility. It's just a good, nice, clean facility. Looks like a doctor's office. Mr. Chairman, we did have Heather. I don't know if she is able to get on.
Heather?
I'm here.
Okay. Hi, Heather.
Hello, nice to meet all of you guys virtually. As Avery said, I am the new director of operations. I'm not new to Ascension, but new to this role. My career, I've started out in prevention and wellness. I've been a health coach. I've been in Chuck's position on the carrier side. I've built incentive programs across the country. Wellness and prevention and employer health is a passion for me. So part of me taking this position, this had a lot to do with it. So I'm excited to partner and collaborate and see what we can do to really integrate the clinic into some of the services that are already available. So I look forward to working with everyone. I got to meet with Ed and Jane Friday and hopefully get to meet with Chuck soon to really talk about those quality metrics. So I'm happy to be here, and if anybody has any questions, I think Ed has my contact information, so please share.
Well, welcome. We're glad to have you. Look forward to a relationship with you and moving forward, and hopefully you can help us get our hypertension rate down. So,
Mr. Chairman.
Yes, sir. Who wants to speak?
This is Mary.
Yes, go ahead, Mary.
I've got a couple of questions for Amber, if we can still talk about that report. On her page 4, when she was telling us of the members types, are they lumping in the retirees and the retiree spouses in the numbers of employee plus spouses, or are they even being counted as they go to the clinics?
I believe they are being counted as employees and spouses since we did not differentiate out beyond that within the reporting. Karen is on this call and she pulls the data for that. Karen, can you confirm that for me, please? You're still muted, Karen.
Karen, are you with us?
I'm sorry, can you hear me now?
Yes, ma'am.
Sorry, I was double muted. We do receive a eligibility file monthly, and that information is in that file. So I do separate those member types out by, like if the retirees, it's not just specified employees, I do capture it in the appropriate member type.
But as for this report, they're just all lumped in as an employee or a spouse, correct?
No, ma'am, it's spouse. They're all separated. Melissa and, I'm sorry.
Karen, would you look at slide 4 specifically?
Yes, on the unique member type, it is the employees are all employees, including retirees. The children are separated out as well. They're not just specified as an employee or a spouse.
Thank you, Karen.
You're welcome.
And then another question, Amber, over on slide 8, but it's a couple different things here. When you talk about the dietitian, where is this? Okay, now I know that we had potential of getting a new person when we swap vendors, so take that all out. Are we still using the dietitian that we had in our money prior to Ascension taking over, or have y'all brought in someone else also? Do we have one plus y'all? I guess is what I'm asking.
So, no, we only have one dietitian, but she did come on with us. She was a new hire when we took it over. So it isn't the previous dietitian that they had with premise, but it is out of your funds. It is your contract with us that has her. She is specific to the Rutherford County clinics, and that is all she is utilized for.
Okay, so now where is she located? When you're talking about the 3 locations, does she hit all 3 of them, or and another reason for asking this is, believe it or not, there are people that watch this and employees that look back. So if we could get a little bit of this information out, other than we talked about on the screen, just mainly where is she located, or does she move around, for the convenience of the employees who may be used to going to the other 2 locations and not the new one?
Sure, yeah. So she does see patients primarily at Stewart's Creek and New Salem. We have talked about some opportunity at Walter Hill, but unfortunately with only the single examiner in there, it's just not very, just not very good for patient care, or somebody else is going to get denied for their regular care, so that she can see people for dietary needs. So we are trying to avoid that. So what we are offering to all patients, though, so that everyone has easy access, is they also can complete these exams virtually. So they can be seen in person at New Salem or at Stewart's Creek, or they can do a virtual visit with her through any location that she's at that day. She also has been varying her schedule to do some days during the week in the mornings and some days late in the afternoon, so that she can balance that with those who have needs to hit different scheduling times. So she's been really trying to meet the need of the member to make sure that it works for them.
Okay, that sounds good. And my last question. You were talking when we were over on the screen with the diagnosis codes about, if I understood and heard right, sometime in February we're looking at setting up a time frame for biometric screening, and did I understand that right and hear that it was sometime in February?
So yes, so we are doing the New Year, New You Wellness Challenge for the first quarter. We partnered with Chuck and Cigna to kind of roll that out and do those kind of things. And one of the incentives in that New Year, New You program is to get that biometric screening and to get that annual physical done. So just to make it a little bit easier for the members to be able to complete that, we organized a week, which also has a county holiday within it, to make sure that we had good access for the members to be able to make those appointments. Because generally for annual exams, because they are so involved, we only have so many slots for them per day. And then they'll have to wait another day to schedule, just to fit it into the schedule. So we took a whole week and focused on that annual wellness exam and opened up those slots so that people could come in and have multiple of those annual exams done for multiple members at all locations for that full week. And it's going to be the week of February 15th through February 20th, which does include that Saturday care at New Salem. We also are opening to those annual wellness exams on that Saturday for people to, again, have additional access outside of their work hours to come in and have that wellness exam done. And then in addition to that, we also have opened up that Saturday morning at New Salem to do the biometric screenings as a walk-in. So those are not nearly as involved. They don't take that much time, but people can walk in between 8:30 and 11:30 at the New Salem location and have that biometric screening done and get it completed, get their points for Cigna, get their points for the Wellness Challenge, and kind of get that out of the way for the year.
All right, and thank you, Amber. And Chuck, can I assume that we're going to be getting an email that we could share, or a little flyer or something that I can print off and put up for the guys, or is it just the employees that have got onto this first of the year wellness challenge?
No, Mary, we've got it scheduled Monday. That communication goes out, and then it'll have a flyer attached to it for everyone, all employees. So that'll be a part of it. So it's not just those a part of that wellness challenge. It's for all employees that are on the medical.
Okay, that sounds great, because I've been having the guys ask about certain things, so that'll give them a little information to put out. I appreciate it, guys. Thank you.
Yep.
Okay, any other questions for Amber, Heather, or Karen? Mr. Edom?
Mr. Chairman, if I could just point out one thing on the dietitian, she's just part-time, but if she continues to stay booked and people have a hard time getting in, we'll revisit those number of hours and see where there's some funds to be able to move it around.
Sure.
Because I think that position could, could be very important, and it is something that, that's the way it was looked at in the past, but, if there's a high demand for it, then we'll make adjustments.
Okay. Any other questions?
Yeah, this is Commissioner Allen. I have a question for Amber.
Amber, you still with us?
Yes, sir. Yes, I am. So what can I do for Ms. Allen?
Is there any opportunity for us to coordinate with the health department that when it's time for us to begin vaccinating the teachers, that we could utilize these MedPoint clinics to vaccinate the teachers?
I believe they're meeting with St. Thomas this week.
Okay.
And is that in regards to, you're talking about the COVID vaccine?
Yes.
Okay, so we really can't answer a lot on that right now, because part of that is which vaccine exactly they'll be utilizing, whether it be the Pfizer or the Moderna, and what the storage requirements and time windows are for that injection for that temperature requirement on the vaccines themselves. So we are working on a plan for the county members and to try to make sure that we get that vaccination available to you as soon as we possibly can. But just know that there are some physical constraints on that, and it may affect where and how we can give that vaccination.
Okay. So along those lines then, Mayor, I guess my comment next is for you, and that is, I know the governor is stressing that he wants us to have, all the schools open and kids in schools, which I completely agree with, but I know our challenge has been staffing. When we've had to close schools, it's been because we've not, the staff has not been healthy enough to be able to accommodate that. So I guess my thought process then is we need to think of some way, and I don't know if LaShannon has already been part of this conversation or not, but we need to think of some way to have a separate avenue for those teachers to be able to be vaccinated as soon as possible.
Well, thank you, Commissioner Allen. We had a mayor's meeting with all the mayors in Tennessee and the governor on a Zoom, and we sent in our questions and requests. We're still waiting for a reply from them. That is at the top of our list to get our teachers back, because as the CDC came out yesterday and said that the young people are basically at a level of being minimal from catching COVID, but it comes back to the teachers, and that's where we run into problems. I think our biggest issue right now is not the vaccine, even though they move the goalpost on us 2 and 3 times a day. It's so frustrating, and so we started yesterday through Mr. York. I tasked him with taking charge. He wrote a software program last week. It took him about a week and a half to put that together, and we are setting up a call bank over in the jury screening room in the judicial building, and we're looking for volunteers that we can get over there to help us man those 20 different phones, and this will be right now our first step into taking care of those who are getting their second round. Going to the teachers, I suggested to Mr. Spurlock yesterday when they were touring the State Farm building that it just makes so much sense if we could just have the school nurse have all the teachers, say at Blackman or Stewart's Creek, show up and take care of the inoculation there in their own school. But right now we're being dictated by the state, and they keep changing it on us. We know that right now we have over 2,000 vaccines. It's just a scheduling problem. They're still using that Sign Up Genius, and it's just not working. So we're on top of that. Had a meeting again this morning, but I told all the school board members yesterday that we're going to try to get our teachers inoculated quickly as possible as soon as they give us a signal from the state. But St. Thomas could help us.
I do have one follow-up thought, and that is, I'm curious, I wonder if it'd be worthwhile for us to invite LaShannon to become part of this committee and to sit in on it, because there are so many times that I hear conversations happening, and I think in the back of my head, I wonder if we've talked to health department, or I wonder if they're part of this conversation. And I know I've brought it up from time to time, but I'm just wondering if it's not worthwhile to have her input just sort of across the board, because they do so many community outreach things as well. I think her insight could be really helpful.
I think that's a good idea. LaShannon is meeting with St. Thomas and Stonecrest tomorrow, I believe, to talk about some of these issues. We've just got to start getting more shots in people's arms as quickly as possible. We can't. The scheduling is not working. So, but that's a good point, Commissioner. Any other questions?
No, go ahead.
Ed?
No, go ahead.
Any other questions for Amber, Heather, or Karen? Seeing none, Madam Clerk, if you would please call the roll for acceptance of the report.
There's not one required.
All right, not required on a motion. So next we go to the wellness update. Mr. Chapa, are you there?
I am, sir. Thank you. All right, so the new Motivate Me 2021 program is up and running. This is an excellent first view at what we're looking at currently compared to last year. And what's great about this is it really kind of piggybacks off of what Amber was saying with some of the different preventative screenings and things that they're doing. So if you take a look at this report, currently right now for annual physicals, we're sitting at 473 versus at 2020 last year. And again, this would have been January of last year, we were at 325. So that was pre-COVID. So we're doing better than we were last year, pre-COVID. Biometric screenings are at 913 versus 632. Health assessments are 264 versus 194. Mammograms, 330 versus 296. OBGYN screenings, 428 versus 396. Colon cancer screens are at 105 versus 137. Cervical cancer screens are 422 versus 321. Prostate exam screens, 139 versus 114. Flu shots, we're currently sitting at 1,793 versus 1,561. And again, we've added those 3 new goals for 2021. So that is work with a health coach and achieve a health goal. So we had 6 individuals meet that goal between October 1st and this report that I pulled last Friday. We've had 2 individuals work with a health coach and overcome a chronic health problem. And then we've had 3 individuals complete 16 weeks of the AMATA Diabetes Prevention Program. Currently sitting, we're at 749 individuals that have met their goal for their points for the year, versus last year we were at 493. So we're basically up across the spectrum except for colon cancer screens, and we actually have a strategy for that going into this year that we're going to start working on with that. So we're doing very well across the board. Going into current and upcoming events, so like Amber mentioned, we've got that annual physical month promotion and the biometric screening event going on. So that whole week of the 15th through the 20th, we're going to be promoting and pushing for annual physicals and biometric screening events. And this will be the first of really a quarterly approach. We're going to try to build on this. So we'll start with this, and then we'll continue to kind of push and give as many opportunities as we can going into this year for members and employees to be able to kind of get their opportunity to get their stuff done. And so we're trying to work to be flexible and able to pivot as things change with the COVID vaccine and everything else. But currently, right now, we do have a pretty aggressive strategy in place to be able to give employees and members the most opportunity that they can. I'm currently working with the on-site mobile mammography team right now, and we're actively working on setting out a schedule for the year to make sure we keep that momentum going. And then Dr. Anthony and everyone, I'll be working and touching base with you all to try to find a strategy for kind of a wellness on wheels, but making sure that we incorporate St. Thomas in the partnership that we have, try to make everyone aware as much as possible that we do have these amazing benefits available to employees, the St. Thomas team, the dietitian, and all the other things, as well as the Cigna components of the benefits. So that's the ongoing strategy. And again, I want to give another shout out to Michaela, who's the population health coordinator for St. Thomas. Her challenge, she's got about 255 people, I believe, Amber, somewhere in there, that she's currently managing with that, and they are knocking it out of the park. And she's really incorporated a lot of great ways to incorporate the incentives and the dietitian and other activities that may increase awareness on that. So we're really doing well going into this portion of the year, and we're really very fresh on this first start of the year, so it's hopeful for the rest of the year as we go into it.
Awesome.
That's all I've got.
Okay. Any questions from Mr. Chapa? Seeing none, we'll move into our last item is their medical, dental, vision, pharmacy. Mr. Elam?
Yes, sir. We put this out to bid, and when the numbers came back, if any of you saw the purchasing meeting, there was folders and stacks from one end to the other. Tremendous amount of information. Mercer came in, dissected it. What you see in front of you, spreadsheet, just kind of giving you the highlights of that information. And then we put together a subcommittee, met with Mayor Ketron, and we wanted to make sure that we could try to get some questions to make sure that we brought the right information to the committee. And so that committee consisted of Mary Hickerson, Mayor Ketron, Doug Bodery, Lisa Nolan, Lois Miller, Sonia Stevenson. And in all fairness, I will tell you, I've been here less than 2 years, and I really, this is a very important decision, and I wanted to make sure that we brought in some experience, and we brought in some financial parts, brought in the schools, and we got a sampling of representation of this committee. So we made sure that we were able to get the information, the numbers to you. So that being said, I'd like to turn that over to Jay Brown and Jake Davis from Mercer.
Thank you, Mr. Elam. Everybody should have in front of you the spreadsheet he was talking about, and what we tried to do, as Mr. Elam said, was take a lot of information and boil it down to 1 or 2 pages so we could kind of make an informed decision. And to back up a second, we started this process in October of 2020. Bids were due in December of 2020, and then we spent the last month and a half or so doing the analysis. This is for a 2022 start date, and this is for medical, dental, vision, stop loss, and prescription drugs. So that is what this RFP covered. The current vendor for all of those services is Cigna today and has been for over 10 years. And what we did on this analysis is, if you'll look at, there's a blue line. Anything above the blue line is what we're going to call a fee or fixed cost. And then below that blue line is a claims analysis. So clearly claims make up a large and vast majority of the portion that you pay when you're talking about the medical plan. But fixed costs are an important component as well. And this RFP is for 5 years. So it's an initial 3 years with the option to extend 2 additional years for a total of 5. So we wanted to look at, what does this look like for the future? I mean, this is a 5-year decision, which is, a ways down the road. How do the fees impact that? How do the claims impact that? What about services? And again, our goal was to find the best partner we can at the best rate and best service level we can get. So if you'll look at the current column, that is Cigna. That is your current fees that you pay today. And what does a fee include? The claims fee includes things like network access, utilization management, claims fiduciary, disease management, communication, wellness. It includes as Chuck was just saying, the wellness platform, the Motivate Me. It also includes your full-time on-site wellness coordinator, engagement consultant, client service consultant. So that fixed cost fee covers those services. And one thing we wanted to do is make sure all quoting carriers quoted similar services on an apples-to-apples basis is what we really tried to make sure we achieved. So if you look at Cigna, currently you're paying them, if you look at the total annual cost on the first column, $2.399, so right at $2.4 million per year that you pay Cigna in fixed costs in the form of fees. Cigna, along with all the other people that got the bid or responded to quote, provided in their analysis or in their proposal what that would look like yearly, and then what that would look like over the course of 5 years. So what we really wanted to make sure is we don't choose a vendor that maybe is lower in year 1, but they mark up the fees years 2 through 5, and overall we're not in a better spot than we were to start with. So what we did, if you'll look at the $2.399 total annual cost, we said what would that look like over the length of 5 years, and that would be $11.99 million. That is what you're paying currently. If you go to the column beside that, this is Cigna as their proposal. And you'll see at the bottom, including all the services you have today, the total annual cost goes from $2.399 to $2.362. So Cigna is actually proposing, starting in 2022 and for the next 5 years after that, a $37,000 fee decrease, which over the course of 5 years is $187,000. Aetna, Blue Cross, Humana, and Lucent Health all also provided medical, pharmacy, and stop-loss quotes. And what we did here was to try to make sure we included, again, all the services. And you can see Aetna is in the 3rd column, Blue Cross is in the 4th, Humana 5th, and Lucent in the 6th. We included all those services, and at the bottom you'll see the fees roll up. And so what we did was say, if you wanted to go to Aetna, the annual cost would be $3.4 million for year 1 or 2022. What would that look like over 5 years? That would be a total of $17 million. Well, that is $5 million higher over the course of 5 years than you're currently paying. And if you look at Blue Cross, they provided a fee. Theirs is a sliding scale fee, so we actually took the middle ground, kind of an estimation, and said if you move to them over the course of 5 years, you would pay $4.6 million more in fees than you are with Cigna. Humana was $7 million more in fees, and Lucent was $8 million more in fees. So what we attempted to do in that first blue box is say, what are the known fixed costs you will pay? What does that look like annually? And what does that look like over the course of 5 years? But we also know that fixed costs are only a portion of the cost. So if you look down below the blue box, you'll see claims. Right now, over the last 12 months, Rutherford County has seen roughly $50 million in medical claims. So we used Mercer's NetPick team, which is an internal team we have made up of actuaries that have run models, and they will allow us to see what those claims would have been under different carriers. So you have $50 million in claims over the last 12 months with Cigna, and this is medical claims. What would that have looked like if Aetna would have been your carrier? from a discount perspective. What about Blue Cross, Humana, Lucent? And what our NetPIC team came up with was, if you moved to Aetna, those claims might have been $49,350,000, which would be roughly $650,000 in savings. Blue Cross was $49,500,000. Humana was $50,500,000. And Lucent actually uses the Aetna network, so they had the same discount at $49,350,000. So the question we ultimately had was, can any carrier provide a claim saving that is greater than the cost of moving from the fixed cost perspective? And the answer on the medical side was no. No carrier over the course of 1 year or 5 could provide enough of estimated claim savings to make up for the between $4.5 to $8 million more in fixed cost Rutherford County would pay. Our NetPIC team said this was one of the first times they had ever seen all 5 carriers within 2%, which is actually the margin of error, so this is somewhat rare. It means in Middle Tennessee, multiple carriers have very solid networks, so it did come down to fees in a sense. And again, Cigna, being the partner they've been, lowering their fees did help them a lot. I want to pause there. It's a lot of information. I know you've seen this, so we covered kind of fixed costs up top, claims on the bottom. We had several subcommittee meetings. Some of you are hearing this for the first time, so I want to open it up and ask for questions before any recommendations or anything like that. Any questions on what you're looking at from an analysis standpoint, who quoted, that sort of thing?
Okay, I'll take questions. I know this is a big pill to swallow, if you will, but it looks like among all the bidders, to me, Cigna wanted to keep our business, keep and retain our business. They sharpened their pencil, even though we're going to have to pay out more than what we have. That's just the state of where we are in today's climate. But I was remarkably surprised that Cigna got that competitive against themselves, which is good for us. Other questions, comments? Now we're going to figure out how we're going to pay for it.
I don't have that answer.
Well, that's not y'all's. That's up to the 21 at a later point in time, but we'll figure it out. Because we do have, this is a good plan, and I think that's part of how we keep good employees is providing good policies for them. Any other questions?
He's ready for the dental and vision.
Yeah, I was going to say, so before any motions are made, let's move to dental and vision as well. So that covered medical, pharmacy, and stop loss. So if we go to page 2, we'll see dental and vision. Again, Cigna's your current carrier on that, has been for a while. We had most of the same players quoting dental and vision with the addition of Delta Dental for the dental product. And you'll see kind of similar breakdown where dental administration or the fee is going to be kind of up top. And then what we added here, instead of adding claims, which in reality the claims and discounts on the dental and vision were not going to be near as drastic or impactful as the medical, we kind of we added a new line which would be fallout, so I'll explain that. But if you look at the dental fee, you're currently paying $280 for Cigna. Cigna has proposed starting 2022 at $250. Aetna was at $196 plus their access fee, so really they were at $231. $310 for Blue Cross, $258 for Humana, and $275 for Delta Dental. And when we look at the total annual cost today, that's roughly $147,000 in fees. Cigna's new proposed cost will be $132,000 in fees. And over the total length of the contract, that's $660,000 total dollars in fees, or $79,000 less than you were paying today. What we wanted to highlight in the case of Aetna, their fee was $2.31. So it was actually about $10,000 or so a year less than the Cigna proposed rate, meaning they were a little lower. The fallout line is, for that $10,000, we ran a utilization comparison. So what dentists are people going to today, and how does that compare from the Cigna network to the Aetna network? And what we found was about 18% of dentists that are in the Cigna network would not have been in the Aetna network. meaning roughly 18% of the population would have had to find a new dentist. So when we ran the numbers, when you look at the fee and the savings, it's very minimal for a somewhat large disruption. If you look at the vision, it follows a similar pattern. Today, the fee is 90 cents. Aetna was at $1.12, Blue Cross at 65 cents, and then Humana and Delta did not quote on this one. So if we take Blue Cross, who had the lowest vision fee, total annual cost of $36,000 over 5 years is $180,000 versus Cigna, which is $249,000 over 5 years. That is some savings. However, 39% fallout, meaning 39% of members for a somewhat minimal savings would have to find a new vision provider. That's why we added that line. We wanted to make sure, again, we were looking at not just cost, but impact as well. As Mr. Mayor said, trying to provide the best benefits we can at the best, with the best service and probably the least disruption, hence the fallout line. So I want to pause there and ask for questions as well.
Questions?
I actually have a statement, Mr. Mayor, if you don't mind.
Yes, Mary.
Speaking to the dental and vision, we just kind of remember and to kind of put it out there so it's on television too. Dental and vision is totally paid for by our employees. It's a cost that we have. The county does not put any money in towards the premiums on these two items.
Good point. Any other questions? Okay. Pharmacy? That's it?
Good. Yep.
Any other questions? Is there a motion?
This is Lois. I'd make a motion to approve retaining Cigna as the plan administrator for the next 5 years from 2022.
Okay, you've heard the motion. Is there a second?
Second for Mary.
Second for Commissioner McAdoo. We're open for discussion. Lisa?
So my question is, on these contracts, is it written that it's a 3 + 1 + 1?
Yep. 3 + 1 + 1.
It's a 3 + 1 + 1 of the 5 years. Okay. Everybody understand that? Okay, other discussion. We have a motion and a second. Ed?
Just for a little bit of clarification on that, it is 3 + 1 + 1, but it's a 5-year guarantee on the price.
Correct.
Okay. Any other questions? All right. That's good. Call the roll, Madam Clerk.
Preble Acton. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Pass.
Amber Brown.
Yes.
Shay Crowell. Holly Deering.
Yes.
Alan Farley. Mary Hickerson.
Yes.
Lois Miller.
Yes.
Alan McAdoo. Jeff Phillips.
Yes.
Shantae Sherrill.
Yes.
Eric Tutobeni.
Yes.
Motion passes. Thank you very much. Is there other business to come before us today? Mr. Elam, have anything?
Have anything?
All right. Other members, anything to come before us?
Mr. Chairman, this is Commissioner Allen. I have a question.
Yes, Commissioner.
Part of Ed's report every month is the OPEB, which is the other post-employment benefits. That number continues to grow, but we never seem to have a conversation about how we're going to meet that obligation or what our plan is long-term for that. The obligation currently is at $169 million. And so at some point, I'd like for us to have a conversation about how we're going to address that.
Okay. Lisa?
The address every year is funding pay-as-you-go. We pay the claims for the retirees based on when they retire. We have not addressed future costs, and that's what that number reflects. one of the things that the county could do is to set up a trust, an irrevocable trust that moves the money over. With that calculation, it's one is how much are those claims costs expected to be in the future, offset against the money to pay for it in the future. Because we don't have a trust set up now, we really have zero. If we had a trust, it's just like a pension. If you had trust, then money's set aside in a trust, then that calculation is that money will grow and help offset the cost. We don't do that, and one of the reasons a lot of the governments haven't gone forward with that is because of that name. It is irrevocable. Once those monies are in that vehicle, it can only be used for that purpose. Those are large numbers. Unlike pension, where you could say we're not offering any pension for this point forward, you still have to maintain those that benefit for all those people that are already vested. Unlike pension, health benefits for retirees is somewhat of a year-by-year thing. Those are huge numbers, but the commission can reduce that by saying we're effective X year, we are no longer providing retiree benefits, and those huge numbers go away. Do you understand what I'm saying? I mean, it's two totally different things. There are ways to offset it. The other way to reduce it, if you think about the way that we've got the various tiers set, is we pay a percentage of the premium. Some of the golden buckets is what I call them, the ones that, regardless of what the premium is, the county's going to pay 50%. You can reduce the benefit, that large number on the OPEB, by saying we will only contribute X amount of dollars. And that's it. So the actuary, when it's figuring out how much is the county liable, when you're saying 50% of the premium cost, they're factoring in cost of medical care, which in some cases are double digits as you go along in the years. But when you say we are only going to provide $1,000 a month, I just pulled that number, $1,000 a month, then the actuary can say it doesn't matter what the premiums are in the future. The county's cost is capped at $1,000 a month per employee. That reduces that outstanding liability. So there are ways that you can do one, trust, change the method of participation in the cost.
And I'm not necessarily endorsing a trust or recommending a trust. I do understand that promise of that obligation can change. The reality is, though, these folks have retired with a certain expectation that we've promised them as of today we're going to do X. But we're saying that going forward, we can change our minds and not do that X anymore. So I just want to make sure that we know that we're keeping our eye on the ball. Because, yeah, that's a scary number. We're watching it grow. I mean, since 2011, it went from 41 million to 169 million. We know that's not sustainable. We can't just let that number continue to grow unchecked. So I just want to make sure that we're not taking our eye off the ball. And because every year when we get ready to address, or every 3 years, whenever it is that we get to address the increases in medical rates, those medical premiums, they always go up. And many times we sort of blend that rate to offset the expense so that the retirees who are costing us the most money don't take the biggest hit. And so I just want to make sure that, like I said, we're just keeping our eye on the ball and watching that and seeing, are we going to be able to continue to make those promises? Are we going to be able to keep those promises that we've made to these retirees? And if not, we need to be having an open conversation about it.
I think that's a real good point, Commissioner, and I'm sure that the Finance Committee that you sit on would be happy to entertain any suggestions of where we start cutting or making changes while we move forward.
One other item, Mayor and Commissioner.
Yes.
and I'll get with Ed on this, is that probably need to give you a history of what we have. When I say we, I'm saying the county, schools, and highway have actually paid retiree benefits. What is that cost of paying 50% of that retired employee's premium? Interesting. I think it would. It is interesting to see over the course of time how that number has increased. You know, I could show you when we go through the budget process where that line is other fringe benefits. It's one of those last categories in the general fund. And schools have it a different place. But to really put the spotlight on how much are we actually paying for the retiree benefits. This number, the OPEB, is actuarial-based numbers, and I always call them the squishy numbers, but the numbers we actually played are hard numbers.
Okay.
Yeah, and that's that's my biggest concern, is just making sure that we are, when we go to the bond market to borrow money, we get a really good rate because we have really strong financial practices and we're very solid in terms of how we manage our money. And so this is just one of those boxes that we don't pay a lot of attention to. And I want to have as much confidence in being able to meet those future obligations as anything else. So it's one of those things we don't talk about. We see it every month on a report and we just kind of pass by it. And I just want to make sure that we've got a fiscally responsible plan for how we're going to meet those obligations.
Every year when we talk to, at least my last 2 years, when we talk to the bond market, they're well aware of it and got their eye on the ball too as far as what we're doing. So any suggestions you and your finance committee can come up with, we'll be happy to address as we start this process that we kicked off 2 weeks ago. Thank you.
Mr. Chairman?
Yes, ma'am.
Just as a reminder, because I've been here, done that for a long time, we made a drastic attempt and changed these numbers that are on this OPEB report as of December 31st, 2010. And at that time, we draw the line in the sand. And we said, if you're at this point in time as of 12/31, on your retirement, here's what we will or will not pay towards your insurance. So this number could be extremely higher had we not done that. And so
sure.
I want it to go on record that we have done something. Yes, now that it's been 11 years, but in those 11 years, I've here at the highway department had folks that retired and we had to go back and said, okay, 12/31/2010, where were you at in the sand? And I've got guys that had been here a while, but based on that is how we pay their insurance. So just to remind everybody, we did make a drastic change in that not everybody gets the 50% pay of the premium. So I just want everybody to remember that, because we do have quite a few new members on our committee, and it's not anything that we didn't take lightly when we done it. Just to remind everybody, we've done something, and these numbers actually could be drastically higher.
Yes, good comments. Lisa?
Mary, as you've said, a lot of people do watch this, and you are right, and it was painful when we did those changes. And a huge change. I told you we could make changes by saying how much we're going to cover in those people that have, that were coming onto the plan at 2010. We set the bar and said it's X amount of dollars that we will cover, and that's it. And we raised how long you have to work for the county to receive that benefit. It used to be 5 and 10, it's 10 or 15 years. Now it's 20 years that you have to work for the county. There used to be, age 55 with 10 years on the plan. 5 years on the plan. I can't remember. But we've increased all those benchmarks to get this benefit. And so Mary is absolutely right. These numbers probably would have been doubled had we not made those changes in 2010.
And maybe another painful decision is in our future. I don't know, but something that, as Commissioner said, we have to keep our eye on it. Anything else? Any other comments before we adjourn? Seeing none, we stand adjourned. Thank you very much for attending today.